Namaste and welcome. Today we are going to talk about the problem of smoking and why it is so addictive. First of all, please remember that cigarette smoke contains the active ingredient called nicotine. When inhaled, nicotine enters the bloodstream and acts on the brain, heart, lungs, and the gastrointestinal tract. In particular, it causes an increase in adrenaline and dopamine levels in the brain. Dopamine in turn activates the reward system in the brain, giving a pleasant sensation when somebody smokes. Due to this pleasant sensation while smoking, the person feels like smoking again and again to activate this reward mechanism. Apart from this, nicotine also causes constriction of the arteries as well as an increase in the blood pressure. All the dependence criteria that are applicable to drinking alcohol and becoming dependent to it are also applicable to smoking. To know more about these dependence criteria, please see the video on alcohol dependence. In addition to all this, whenever a person tries to quit smoking, then the reward mechanism is shut off. This causes unpleasant withdrawal symptoms, which results in the person smoking once again. There are certain myths associated with smoking which I would like to address now. One of the excuses for continuing to smoke is that it is a stress buster. In actual fact, nicotine can act as a stimulant of the brain, leading to restlessness, tremors and palpitations, all of which are symptoms of anxiety. Therefore, smoking cigarettes can worsen anxiety. Smokers also feel that they can stay awake longer if they smoke, making it easier for them to prepare for exams, for example. It is worthwhile remembering that because smoking can act as a stimulant of the brain, it can keep you awake for long periods, and if you continue smoking for a long period, the sleep may be affected. Smoking is also associated with socialization, that is, when friends meet, they usually end up smoking together. However, you have to ask yourself at what cost. What about the adverse effect that smoking is having on your overall health? It is advisable to find ways of meeting friends which does not involve smoking, drinking heavily, or taking any other street drugs. Smokers also feel that they can quit the habit of smoking very easily. Please note that nicotine is one of the most addictive substances in the world. Therefore, quitting smoking is not an easy task. The cigarette smoke contains hundreds of harmful chemicals. Smoking leads to respiratory problems, and in particular it can cause cancer of the lungs. It is, however, worthwhile remembering that not all smokers go on to develop lung cancer. On the other hand, all cases of lung cancer are also not caused due to smoking. Smoking is also a major risk factor for strokes, heart attacks, and cancer in any other part of the body. In both men and women, it can lead to infertility. In men, it can lead to erectile dysfunction and low sperm count. If women smoke during pregnancy, it may result in birth defects in the developing fetus. In particular, there may be cleft lip and cleft palate, low birth weight, premature delivery, and even stillbirth. As we have already discussed, smoking can cause or worsen anxiety and stress. It can also cause sleep disorder. Nicotine replacement therapy in the form of lozenges and patches are available. These can be combined with other medications such as bupropion and varenicline. All these are anti-craving medications, that is, they act by reducing the desire for smoking. Vaping or e-cigarettes are also not advisable because they can also be harmful. If you are a smoker and want to quit smoking, then please look at developing alternative activities and distract yourself from smoking as much as you can. Meditation may help in this regard. Please remember that apart from all these measures, the main thing that decides whether you will successfully quit smoking or not is your willpower. Therefore, prevention once again is better than cure, and say no to cigarettes the first time and every time, and stay healthy. Thank you for watching this video. Namaste.